Hey everyone, Dr. Alex Twenge here. In this video, we're going to be doing a standing shoulder evaluation on our one and only therapist, Megan Twenge.
Hello.
We have been doing this for a while now, kind of like pre-test, post-test. That's what we're going to do here, guys. We're going to do a little bit of this, a little bit of that. We're going to show you kind of how it improves.
Yeah.
We're right away in the morning here. We haven't done anything. We haven't done any breathing. We wanted to get you guys a good baseline of what Megan's like right when we wake up in the morning if we haven't done anything. Now, go ahead and we're just gonna get right into the eval here, guys. Thumbs up, looking straight forward, and I want you to go ahead and rotate your thumbs down for us, Megan, so we can see the difference. Now you guys can see how this right side lifts. That means that we're recruiting this levator scap to actually tip the shoulder blade up instead of us being able to depress the shoulder blade and rotate. Now go ahead and put those back down. Thumbs right out in front of you. Now, this is where she's limited. Go ahead and go thumbs overhead, Megs.
Okay.
So we can see how this shoulder is actually further away from her head. You can see the difference in the light here. You can see my fat face here. Can't see my fat face as much here, right? Super simple. Now, how does this feel, Megan?
Okay, so this is very uncomfortable for me, and this is my norm. If I were to cheat and show you guys my better range of motion, you'd see, yeah, my shoulders look better, but my low back looks like crap.
So do that again for me. Show them one more time. Right here, we're looking at, see how her rib cage lifts up? Go back before you cheat. Go back to before you cheat. So here, we're stacked. We're keeping our pelvis and our rib cage combined. We're allowing ourselves to actually work how we're supposed to, right? We're keeping everything in concert. Now, go ahead and open those scissors up. You can see how her ribs open and her pelvis drops away. This inhibits or puts her abdominals, your transverse abdominis, and her internal obliques on stretch.
It's exhausting.
So, and you can see the last thing we do, guys, one more time. I'll make her do it one more time.
Okay.
One more time. So you can see how her back actually turns on and becomes her shoulder, which is not what we want. Now, go ahead and go back in that pack position. Just so you guys can see this, I'm going to grab around her ribs. That's all we're getting, and I am yanking on her shoulder. Now, we're going to do a quick bit of breathing. Go ahead and lay on the ground right there, Megs. All right, guys. This is what Megan does pretty consistently with a lot of our patients.
Yes.
We are just going to take and get the ribs and the pelvis to start working with each other through using our diaphragm, right?
It's just breathing. Yeah,
Yep.
It's just breathing the right way, and I've never breathed the right way. I've always been a chest breather, and my chest raises up instead of my diaphragm, so I haven't been using those core muscles the right way. And so yeah, I'll just go through teaching what I do with most of our patients here. So see how my back is curved. We want your low back to be actually in contact with the floor, so nice and flat, and then that automatically puts your hips in that stacked position that Dr. Alex was talking about. And then all we do, we get set, we breathe in through our nose, all the way down into our belly, not your chest. Your chest should not move at all. And then when you breathe out, it's like you're blowing out 100 candles. So it's a little bit of force because you want to actually turn on those muscles. So.
And what we're trying to do here, guys, is we're turning on transverse abdominis, internal obliques. So internal obliques are right here. Transverse abdominis runs deep to rectus abdominis, which is like that six-pack abs. We're trying to turn things on that are underneath. These connect ribs to pelvis, which allows us to stay in a neutral spinal arrangement and allows our shoulder blade to actually swing on our rib cage instead of just tipping. So as you can see, Megan also will lift her glutes. She'll get a little bit of glute activation, which is kind of like more advanced. She's cheating because she knows how to do this. But what we're trying to do is create synergy here to allow the shoulders to do what they're supposed to instead of compensating for moving however we want to move them, right?
Right.
Give me one more good one. So what is this, breath number 4? Breathe it out, breath number 4, getting really good IO, really good internal oblique, really good transverse abdominis, awesome.
Okay.
All right?
Back up.
Let's see if we made any difference. Go ahead and stand back up, Megs. Align yourself underneath that thing. Okay, cool. Now, we're gonna use that same breathing technique, all right, guys? So you're gonna see her go, lock down.
From the side.
Yeah, and we're just gonna go right from the side. That's why Go ahead, lock in. She's gonna stay neutral, keep her scissors closed. Bippity boppity. I mean, any difference?
I'm all stacked, and look how far back my shoulders are.
How does it feel?
Great, my low back isn't on. I don't feel like I'm holding
So
all
now,
of
just
my
so you guys can
upper body
see it
there.
from the front, flip to the side. Same thing. Stack it up, allowing the shoulder blades to do what they're supposed to. I mean, and that was 5 breaths. Cool stuff, huh?
Yeah, that's good.
This is what we do. It's pretty sweet. We love it. Come in and check us out. See you guys next time.